system that I even use in my office. We've done a lot of research in the Gonstead system, and we've proven a lot of the adjustments that we use for as far as low back or what have you. We seem to get tremendous results in the Gonstead Clinical Study Society. They're doing such a big job today. And I know you do a lot of research for the Clinical Study Society. It's the Gonstead technique in general. How does that compare to most other, I should say, other techniques, or how should I say, or to these modalities? How would you compare that? What's your opinion on that?
Well, compared to different modalities, I don't think there's really much of a comparison. There's far more science on the chiropractic end of things.
Sure.
But your question kind of is looking at, is the Gonstead system superior to some other technical system in chiropractic? We really don't know that. What we do know is there is some evidence that the Gonstead system does improve ranges of motion. It does improve some of the alignment properties of the spine. We're studying different things like asthma, hypertension, other disorders, and how the Gonstead system might influence those particular disorders. But really, we haven't gotten to the point where we're comparing it head to head. So I have to put on my researcher's cap right now and say, is there really solid scientific evidence? No. It's more of an unknown at this point. I have a lot of belief along those lines, but as a scientist, it's hard for me to say that it's proven. And that we can see that in a scientific journal.
That's a fair question. As far as back problems, let's talk a little bit about back problems. Seems to be everybody has back problems. They already have disc degeneration, and when you get older, you have this disc degeneration, you have more back problems. Can we clarify that a little bit for our viewers out there? I mean, where back problems start and where do they end, or do they end?
Yeah, there's been a lot of misinformation over the past 50 years about back problems, and we're just now starting to get a handle on it. Some of this misinformation revolves around the idea that back problems go away, and that if you just give it a little time, your back pain will go away. And the reason this sort of slogan came about is because if you go to see a medical doctor with a back problem and you're prescribed a particular medication or some exercises to do, whether or not your back problem's any better, you usually don't go back to that medical doctor. And I think what happened is this led to the perception among medical doctors that they cured the back problem, that it went away because the patient didn't come back. But now there's some studies that have come out just recently in the past 2 years where they've actually asked patients a year later how they've gotten on, and they don't do very well. The back problems keep recurring, and a sizable percentage of patients, like over 50%, still have the same symptom a year later after the original diagnosis. And the conventional wisdom was that these symptoms would just go away in 30 days and we'd never hear from this patient again. So that's one thing about back problems that has kind of come out recently. The other thing is that pain doesn't seem to be a good predictor for back problems or not. So sometimes we think about back pain as the back problem, and if we don't have back pain, there is no back problem. And once the pain is away, the back problem is completely gone. And really, pain fluctuates and is kind of dependent on the individual. And if we took the same approach and applied it to our teeth, then we'd only be going to see a dentist when our teeth hurt. And we all know that if we did that, we'd be ready for a root canal in a few decades because we didn't get to problems before they caused permanent damage. And the same thing can be said for the spine. It seems that back problems start in our early age groups. They don't start when you first bent over and twist in your backyard, or you lifted something too heavy in your 20s. They really start in the younger ages. It can even start as early as your birth, in terms of where your spine is setting up certain patterns. And certain studies have shown that even things like disc degeneration that can be seen on an MRI in people as early as 15 years of age, about 15% of 15-year-olds without any back pain whatsoever show disc degeneration. So this tells us that at a very early age, things are starting to happen. Now, if you look at an adolescent, a 15-year-old who has back pain, between 20 and 30% of those patients will show changes in the disc at this early age. And because the MRI, magnetic resonance imaging, hasn't come about until the 80s and 90s, we really haven't had an opportunity to study these younger patients. So that's telling us that the problems are starting early. And other research has shown that if you have back problems in adolescence, you're more likely to be an adult with back problems. So that back pain doesn't go away once you start off with it. You tend to have more and more problems with it. And so we really need to focus our attention not when the acute injury, when the pain is brought to the office when the person's 30 years old, but try to prevent those things by going back and addressing the spinal problem early in life, I think is a better approach.
So in other words, an ounce of prevention is worth more than a pound of cure, or whatever that
much more
that analogy.
Yes, and we definitely need to do studies to see that this truly does prevent them. But what we know now is that these problems are starting at a younger age, and we shouldn't probably wait until pain comes out before we start to say that somebody needs to be checked by our chiropractor.
Okay, so we should be getting in and getting adjusted more often, and
at least check.
Get ourselves at least checked so we don't run into these problems later on down the road, because once these problems do come about, then we're really going to start having some disc degeneration, or really start having some complications because of it then.
Right.
Well, I'll tell you what, we're running out of time, and you give us a lot of information. I know you're doing so much research, and we really appreciate you doing the research out there. And I want you to keep on doing it. And again, I'd like to have you on the show maybe, say, in a few months from now, when you come up with some new research and some more findings that you're doing right now. And because a lot of people out there really need to know. They need to be more, we need to be more preventive awareness instead of let's fix it when it's broke.
Right.
So anyways, we're going to definitely get you back on again, and then we're going to talk about maybe one subject just in depth, really in depth, about, say, a back problems or high blood pressure or what have you. I really enjoyed having you here today, and thank you very, very much for being on the show. And if any of our viewers out there would like to find out a little bit more about what we had talked about today, you can contact me. My number will appear at the end of the show, and we will send you out the appropriate information. And again, until next time, I'm hoping you and your family the best of good health.